There are two types of trypanosomiasis: African trypanosomiasis or sleeping disease, and American trypanosomiasis or Chagas disease. African trypanosomiasis. Human African trypanosomiasis, sleeping sickness, African lethargy or Congo trypanosomiasis is a parasitic disease of people and animals caused by protozoa of the species Trypanosoma brucei and transmitted by the tsetse fly. It is estimated that 50,000 to 70,000 people are currently infected. The disease is endemic in some regions of sub-Saharan Africa, covering about 37 countries and 60 million people. Disease caused by protozoa of the species Trypanosoma brucei. The tsetse fly is a large brown biting fly that serves as both a host and vector for the Trypanosoma parasites. While taking blood from a mammalian host, an infected tsetse fly injects metacyclic trypamastigotes into skin tissue. From the bite, parasites first enter the lymphatic system and then pass into the bloodstream. Inside the mammalian host, they transform into bloodstream trypamastigotes and are carried to other sites throughout the body, reach other blood fluids, and continue to replicate by binary fission. The entire life cycle of African trypanosomes is represented by extracellular stage. A tsetse fly becomes infected with bloodstream trypamastigotes when taking a blood meal on an infected mammalian host. In the fly's midgut, the parasites transform into procyclic trypamastigotes, multiply by binary fission, leave the midgut, and transform into epimastigotes. The epimastigotes reach the fly's salivary glands and continue multiplication by binary fission. The entire life cycle of the fly takes approximately 3 weeks. The clinical course of human African trypanosomiasis has two stages. In the first stage, the parasite is found in the peripheral circulation, but it has not yet invaded the central nervous system. Once the parasite crosses the blood-brain barrier and infects the central nervous system, the disease enters the second stage. The subspecies that cause African trypanosomiasis have different rates of disease progression, and the clinical features depend on which form of the parasite. Trypanosoma brucei rhodesians or Trypanosoma brucei gambiense is causing the infection. However, infection with either form will eventually lead to coma and death if not treated. Trypanosoma brucei rhodesians infection, East African sleeping sickness, progresses rapidly. In some patients, a large sore, a chancre, will develop at the site of the tsetse bite. Most patients develop fever, headache, muscle and joint aches, and enlarged lymph nodes within 1 to 2 weeks of the infective bite. Some people develop a rash. After a few weeks of infection, the parasite invades the central nervous system and eventually causes mental deterioration and other neurologic problems. Death ensues usually within months. Trypanosoma brucei gambiense infection, West African sleeping sickness, progresses more slowly. At first, there may be only mild symptoms. Infected persons may have intermittent fevers, headaches, muscle and joint aches, and malaise, itching of the skin, swollen lymph nodes, and weight loss can occur. Usually after 1-2 years there is evidence of central nervous system involvement with personality changes, daytime sleepiness with nighttime sleep disturbance, and progressive confusion. Other neurologic signs such as partial paralysis or problems with balance or walking may occur, as well as hormonal imbalances. The course of untreated infection rarely lasts longer than 6-7 years and more often kills in about 3 years. The diagnosis of African trypanosomiasis is made through laboratory methods. The diagnosis rests on finding the parasite in body fluid or tissue by microscopy. Trypanosoma brucei parasites can easily be found in blood. They can also be found in lymph node fluid or in fluid or biopsy of a chancre. Serologic testing is not widely available and is not used in the diagnosis since microscopic detection of the parasite is straightforward. All persons diagnosed with African trypanosomiasis should receive treatment. The specific drug and treatment course will depend on the type of infection. Trypanosoma brucei or Trypanosoma brucei and the disease stage. Pentamidine, which is recommended drug for first stage Trypanosoma brucei infection, is widely available in the USA. The other drugs, suramine, melarsoprol, L-ornithine, and nifurtimox, used to treat African trypanosomiasis, are available in the USA. Prevention and control. There is no vaccine or drug for prophylaxis against African trypanosomiasis. Preventive measures are aimed at minimizing contact with tsetse flies. Use insect repellent. Control of African trypanosomiasis rests on two strategies: reducing the disease reservoir and controlling the tsetse fly vector. American trypanosomiasis. Chagas disease, also called American trypanosomiasis, is a tropical parasitic disease caused by the flagellate protozoan Trypanosoma cruzi. Trypanosoma cruzi is commonly transmitted to humans and other mammals by an insect vector, the blood-sucking insects of the subfamily Trypanomine. Chagas disease affects 8 to 10 million people living in endemic Latin American countries, with an additional 300,000–400,000 living in non-endemic countries including Spain and the United States. An estimated 41,200 new cases occur annually in endemic countries, and 14,400 infants are born with congenital Chagas disease annually. About 20,000 deaths are attributed to each year. Chagas disease is contracted primarily in the Americas, particularly in poor rural areas of Mexico, Central America, and South America. Disease is caused by the flagellate protozoan Trypanosoma cruzi. An infected Trypanomine insect vector or kissing bug takes a blood meal and releases trypamastigotes in its feces near the site of the bite wound. Trypamastigotes enter the host through the wound or through intact mucosal membranes, such as the conjunctiva. Inside the host, the trypamastigotes invite cells near the sites of inoculation, where they differentiate into intracellular amastigotes. The amastigotes multiply by binary fission and differentiate into trypamastigotes and then are released into the circulation as bloodstream trypamastigotes. Trypamastigotes infect cells from a variety of tissues and transform into intracellular amastigotes in new infection sites. Clinical manifestations can result from this infective cycle. The bloodstream trypamastigotes do not replicate, different from the African trypanosomes. Replication resumes only when the parasites enter another cell or are ingested by another vector. The kissing bug becomes infected by feeding on human or animal blood that contains circulating parasites. The ingested trypamastigotes transform into epimastigotes in the vector's midgut. The parasite multiply and differentiate in the midgut and differentiate into infective metacyclic trypamastigotes in the hindgut. Chagas disease has an acute and a chronic phase. If untreated, infection is lifelong. Acute Chagas disease occurs immediately after infection, may last up to a few weeks or months, and parasites may be found in the circulating blood. Infection may be mild or asymptomatic. There may be fever or swelling around the site of inoculation. Romanas sign, the swelling of the child's eyelid, is a marker of acute Chagas disease. The swelling is due to bug feces being accidentally rubbed into the eye, or because the bite wound was on the same side of child's face as the swelling. Following the acute phase, most infected people enter into a prolonged asymptomatic form of disease called chronic indeterminate, during which few or no parasites are found in the blood. During this time, most people are unaware of their infection. Many people may remain asymptomatic for life and never develop Chagas-related symptoms. However, an estimated 20–30% of infected people will develop debilitating and sometimes life-threatening medical problems over the course of their lives. Complications of chronic Chagas disease may include heart rhythm abnormalities that can cause sudden death, a dilated heart that doesn't pump blood well, a dilated esophagus or colon leading to difficulties with eating or passing stool. The diagnosis of Chagas disease can be made by observation of the parasite in a blood smear by microscopic examination. A thick and thin blood smear are made and stained for visualization of parasites. However, a blood smear works well only in the acute phase of infection, when parasites are seen circulating in blood. Diagnosis of chronic Chagas disease is made after consideration of the patient's clinical findings. Diagnosis is generally made by testing with at least 2 different serologic tests. Treatment for Chagas disease is recommended for all people diagnosed with an acute infection, congenital infection, and for those with suppressed immune systems, and for all children with chronic infection. Adults with chronic infection may also benefit from treatment. For cardiac or gastrointestinal problems resulting from Chagas disease, symptomatic treatment may be helpful. Prevention and control. In endemic areas of Mexico, Central America, and South America, improved housing and spraying insecticide inside housing to eliminate Trypanomiasis bugs has significantly decreased the spread of Chagas disease.